Okay, we're gonna get started with our program now. So good afternoon again. My name is Joanna Marsh, and I am the head of interpretation and audience research at the Smithsonian American Art Museum. It's a pleasure to be with you today and to present this online version of our popular in-gallery program, Double Take. This series brings curators from the American Art Museum into conversation with scholars from across the Smithsonian to reveal the unexpected connections between American art and nearly every subject we cover here at the Smithsonian, from history to anthropology, astronomy to zoology. Today, we'll be exploring the intersection of art, medical history, and one of the most challenging global issues of our time, the novel coronavirus pandemic. COVID-19 has fundamentally transformed our lives over the past 8 months. It has led to nearly 250,000 deaths in the United States and 1.3 million global deaths since reporting began last December. During this time, the coronavirus pandemic has had a disproportionate impact on Indigenous communities around the world, exacerbated by contemporary social and economic inequities. The COVID-19 pandemic has amplified both the vulnerabilities and resilience of Indigenous communities. Today, we'll explore the effect of the pandemic on Native American communities specifically by examining 3 protective masks made by Native artists during the pandemic. We'll also learn about the Smithsonian's pan-institutional collecting initiatives to preserve documents and objects related to the pandemic, in particular masks. And finally, we'll hear how masks being produced and used for the current pandemic fit into the history of mask use during prior pandemics and epidemics. To illuminate these topics, I'm joined today by 3 Smithsonian scholars. Anya Montiel is the curator of American and Native American women's art and craft, a joint position at the Smithsonian's American Art Museum and the National Museum of the American Indian. Anya previously worked at the National Museum of the American Indian and joined the American art staff just before the coronavirus pandemic began in February 2020. Her research has appeared in American Indian Magazine, Art in America, as well as exhibition catalogs for the Crystal Bridges Museum of American Art, the Heard Museum, and the Hood Museum. Anya brings broad expertise in Native American studies and anthropology to the work of building the American Art Museum's holdings of art and craft by Native women artists. Anya is joined today by her colleague from the Smithsonian's National Museum of the American Indian, Cécile R. Ganteaume. Cécile holds degrees in art history and anthropology and has been a curator at the Smithsonian since 1990. Her work focuses on American Indian art, culture, and history. Her most recent projects include the exhibition Developing Stories, Native Photographers in the Field. She is also the co-curator of the exhibition Americans at NMAI DC. She's currently working on a photography exhibition that provides an insider's view of the toll the coronavirus pandemic is taking on the Navajo Nation. To help us understand the coronavirus pandemic within the context of other historic pandemics, we're joined by Alexandra M. Alexandra is the chair of the Medicine and Science Division at the National Museum of American History here at the Smithsonian and a curator of the history of medicine. She is leading the museum's Rapid Response Collecting Task Force, which is acquiring artifacts related to the pandemic and capturing history as it unfolds. Thank you all for being with us today for this incredibly timely discussion. I'm going to let you all take it from here. And Anya, if you would start things off by telling viewers more about the 3 Native American masks that you recently acquired for the museum.
Yes, thank you, Joanna, for that introduction and for the invitation to participate in the Double Take program series. Hello, everyone. I'm honored to speak with my colleagues across the Smithsonian about our responses to the COVID-19 pandemic. For part of my time, I work at the Renwick Gallery. For those of you who do not know, the Renwick is part of the Smithsonian American Art Museum. Part of its vision is celebrating makers taking both innovative and time-honored approaches to their work. My work has also been guided by the Secretary of the Smithsonian, Lonnie Bunch, who recently said that the job of a museum is not just to look back, it is to collect today for tomorrow. With those points in mind, I had been thinking about future acquisitions. In April 2020, I then saw the virtual art exhibition, Masked Heroes, Facial Coverings by Native Artists, organized by the First American Art magazine. More than 70 artists submitted 125 functional and artistic face mask creations using cloth, leather, cedar bark, plastic, and other materials. I consulted with the other Renwick curators about acquiring masks for the permanent collection from the exhibition, and they were in agreement. I then contacted some of the curators at the National Museum of the American Indian and found that they were acquiring some of the masks as well. So we worked together to make sure that the museums were not competing against each other for the same mass. Also, the Renwick has a smaller geographic focus, the United States, versus the National Museum of the American Indian, which is a hemispheric museum. I then contacted the artists, and luckily the masks were available for acquisition. Next slide. The first mask is a yellow cedar face mask by Vicki Sobolev, who is a Haida artist, performer, and teacher born in Seattle, Washington, and raised in Ketchikan, Alaska. She learned Haida basketry from many master weavers and also apprenticed with artists on raven's tail weaving. Her face mask is functional. It is woven with splints of yellow cedar and finished with ties of braided sinew. In creating this mask, she said, "I decided to make a face mask because I was under the Washington state stay-at-home mandate, and many people began to sew face masks, but I am not an accomplished seamstress. I am, however, an experienced weaver of red and yellow cedar. One evening, as I watched the news, the red and yellow cedar face mask came to me. I jumped up from my chair and began assembling the supplies. I had completed the first face mask by late evening, and I was incredibly happy with it." So next slide. The next mask is by Katrina Mitten, who is a bead artist and a citizen of the Miami tribe of Oklahoma. She lives in a small town on the traditional homelands of her people in Indiana. At the age of 12, Mitten began learning the traditional arts of the Miami people, focusing on beadwork and traditional clothing. Her mask is entitled MMIW, or Murdered and Missing Indigenous Women, and is made of dark cotton fabric and ribbon and beaded with a red handprint in check seed beads. The top border of the mask is decorated with shell discs, and the bottom fringe consists of bone hair pipes and teardrop beads. As Mitten explained to me, when I'm working on something like the mask competition, I'm using ideas that are inspired by current situations. The MMIW atrocity has inspired me in a few of my pieces, including this mask. Many women use the hand symbol across the mouth as a symbol of this movement to bring attention to the horrible injustices that are occurring across Indigenous communities throughout North America. Having to wear protective masks for our health would cover those who chose to paint the handprint on their faces, so I decided to bead it to the mask. And next slide. The third mask is Marlana Thompson's Onunkwasuna Medicine Plants face mask. She is Mohawk, Wolf Clan, a bead artist and regalia maker from Akwesasne. She has been sewing and beading works of art since the age of 7, and she operates a business specializing in Mohawk beadwork and clothing. Her mask is made of black velveteen and beaded with check seed beads. The mask depicts beaded strawberries, white pine, and cedar, along with C19 2020 on the right side to commemorate this current moment. The bottom row depicts 3 sky domes, which represent prayers for her children. The mask contains sweetgrass and sage inside, with leather ties on the side to secure to the face. As Thompson explains, the mask is my way to give thanks to the medicine plants Creator has given us to heal. This pandemic has forced us to take a good look at how we are living and at the things we bring into our communities and homes. It will force many people to seek out our traditional teaching for gardening and harvesting foods and medicines. We should never forget what has happened, and we should all grow from it. Next slide. These masks are currently on view at the Renwick. There are more masks being acquired, but they haven't been accessioned yet, so I have no images to share with you. And now I would like to introduce my colleague, Cécile Ganteaume from the National Museum of the American Indian, and I can't wait to hear about the projects at that museum. Cécile.
Thank you, Anya. Ladies and gentlemen, it's a pleasure to be talking to you today, especially alongside Anya Montiel and Alexandra M. Now, we all felt that in order to best contextualize the Smithsonian's collecting of Native American masks made in response to the COVID-19 pandemic, that we should talk about the actual impact of the pandemic on Native Americans vis-a-vis the rest of the country. And as Johanna Marsh said, the fact is that COVID-19 is having a disproportionately higher impact on Native American and Alaska Native populations, both in terms of the severity of infections and deaths. According to a July 31st article in the Washington Post that was based on data gathered by the Center for Disease Control, death rates from COVID-19 this summer were far higher among Native Americans and Hispanics than any other race category in the United States. And again, according to the Post analysis of CDC data, COVID-19 has accounted for 20% of Native American deaths this summer. So why are Native Americans disproportionately impacted by COVID-19? Well, according to doctors and researchers at the Johns Hopkins Center for American Indian Health and the U.S. Indian Health Service, Native Americans were already suffering from higher rates of infectious and respiratory diseases than was the general U.S. population prior to the pandemic. This fact, along with the remoteness of Native communities on reservations, unpaved roads, lack of electricity, poor if any internet connectivity, large multi-generational households, and high rates of food and water insecurity have contributed to the COVID-19 situation becoming critical on many reservations. I think it's fair to say that the COVID-19 pandemic has severely strained many tribal infrastructures and that it did not help Native Americans that the US federal government was slow to respond to their unique challenges. Native Americans were not singled out as a distinct demographic in early attempts by researchers to gather data on the spread of the pandemic in the United States. And this has led to the claims on the part of some journalists that Native Americans have been invisible in reports that could have led to reservations receiving vital supplies and public health expertise in a timely manner. It is perhaps for this reason that one, Native Americans were not considered in early drafts of the relief legislation known as the CARES Act that was passed to help Americans cope with this crisis. And two, although Native Americans were finally included in the CARES Act, that according to a report written by researchers from Harvard, the University of Arizona, and UCLA, a severe misallocation of federal funds left some tribes severely underfunded. Nonetheless, faced with this global crisis playing out in their communities, tribes themselves have launched multi-pronged strategies in their efforts to contain and combat the spread of COVID-19. They've opened up their reservations to healthcare professionals to work with their own public health departments. They've developed and disseminated bilingual public health guidelines. They've worked with cultural and spiritual leaders to rethink community events, set weekend curfews, close their reservations to non-residents, provided free COVID-19 testing, and enacted contact tracing to find and isolate COVID-19 cases. The fact is, across the country, many Native nations have imposed ambitious public health measures in their efforts to flatten the curve of COVID-19 infections on their reservations. I think that it is with this knowledge in mind that we should be thinking about the masks made by Native American artists in response to the COVID-19 pandemic, which are being acquired by the Smithsonian. The creation of these masks is born out of an all too deep awareness of the impact that the virus is having on Native American peoples and on the importance of wearing masks in stopping the spread of the virus. The National Museum of the American Indian was spurred to begin collecting masks by the virtual art exhibition with Anya mentioned, titled Mask Heroes, Facial Coverings by Native American Artists, that was organized by the First American Art magazine. Whether protective or decorative, made from traditional or innovative materials, the masks acquired by the Smithsonian, including the very one seen here, ultimately speak to how this global pandemic is disproportionately impacting the lives of Native Americans. Beyond this, I recently heard a photographer say that it is through art that we communicate to future generations. Through the collection of these life-affirming masks, the Smithsonian will be able to demonstrate to future generations the determination across Native nations to combat the spread of COVID-19 and the coordinated "we will pull through this" message of their artists. Lexi, I understand that the National Museum of the American History is also collecting masks, and not only those made by Native Americans. Will you share with us what your museum is up to?
Thank you, Cécile. Yeah, I'm very pleased to share what we've been doing on a broader scale. And I'm going to talk a little bit about the history of mask wearing as well and what it means from a medical perspective. And I wanted to start with this image, which our museum hopes to collect because I think it's a very powerful one. It reflects that combination of history and tradition, but also medical imperatives. As Cécile mentioned, COVID-19 has impacted communities of color especially hard, and Indigenous communities, especially like the Navajo, have been even more hard hit. So this image for us has multiple layers. It reminds viewers of the importance of wearing masks from a medical perspective, but that wearing masks also does not interfere with one's identity. So as we've been thinking about how people are creating, sharing, and wearing masks, I thought it might help to give a brief historical overview of the masks from the perspective of a medical historian. And as you'll see in the discussion that will follow, our division of curators at the National Museum of American History, we've been thinking about masks from a slightly different angle from my colleagues at the Smithsonian's art museums. So obviously this is the big image that almost everyone always thinks about when you think about the history of wearing masks. People tend to think about the Middle Ages, they think about Europe, and they think about bubonic plague. And that's pretty understandable because in the 14th century, Asia and Europe experienced a major pandemic, which was a killer. It's hard for us to know how many people died, but estimates are about 1/3 of the population. But neither European nor Asian doctors actually wore this kind of plague mask that we so often associate with the Middle Ages. Instead, in the 14th century, doctors believed that the air around a patient who was suffering from plague was contaminated, but they used a vinegar-soaked sponge and they put that in front of their face to protect themselves. Plague pandemics occurred repeatedly in Europe and Asia from the 14th right up into the 20th century. And so doctors did actually try to protect themselves. And in the early 17th century, in the early 1600s, European physicians began to wear a mask, believing that it could protect themselves from the contaminated air. The plague mask that we see here that we associate so much with the Middle Ages is really that 17th century in development. And it was developed by a French physician. He was the physician to the king, and he used a mask which was made of leather and had that very distinctive, very long nose. Sometimes also herbs would have been put in that nose to protect the wearer. That was believed to protect them from contaminated air, which could spread plague. So this mask was used predominantly during the 17th century, although there were plague outbreaks right up into the 18th century. And if I could ask for the next slide. So it's really in the 19th century that we begin to see a different type of mask emerging. And this is what we associate with the surgical mask. And here you can see William Mayo of the famous Mayo Clinic wearing a mask, and we all know now how to wear masks, so we can see that he's wearing it incorrectly. He has his nose outside the mask. So you can see that it's a sort of staged process in which doctors began to adopt and wear masks during the 19th century. And this was influenced by the emergence of germ theory, the idea that microorganisms spread disease. In the late 1800s, physicians and surgeons in particular began to wear masks to prevent contaminating a patient. And it's actually really around bubonic plague outbreaks, again, that masks really come to the fore. In the 1890s, there's a bubonic plague outbreak in Hong Kong, and doctors and nurses begin to wear masks because patients, just a symptom of what's happening to them, begin to spit in their face, and the doctors realize that this can spread plague. In 1911, there's a dramatic illustration of the power of the wearing of the mask. A French physician refused to wear a mask. He caught plague in Manchuria and died. A Chinese physician actually did wear a mask and was not infected. So this many people took as real evidence of the power of the mask to protect themselves. So if I could have the next slide. But it's really the 1918-1919 influenza pandemic that really brings the mask into common usage. This pandemic killed roughly 600,000 Americans, but there were about 40 million who died from the pandemic across the world. Some scientists believe that about a third of the population at one time were infected with influenza in 1918-1919. So there were mask mandates during this pandemic, and there were also people who objected to the wearing of masks during this pandemic as well. The American Medical Association began aggressively advocating mask wearing, and many cities passed laws requiring people to wear masks. But there were major protests, most notably really in San Francisco, interestingly enough. It's really toward the end of the influenza pandemic, people began to become very careless about mask wearing. So it's actually one of the most intense periods of infection during the influenza pandemic. After the pandemic, masks became really widespread and common among the medical profession, with the 1920s really introducing sort of mass production of masks. But it's really in the 1960s and 70s that you begin to associate physicians and surgeons always wearing masks. Ironically, there's an idea that they're becoming increasingly careless sometimes about it because it's become so commonplace. And it's in 1995 that we see the introduction of that N95 mask, which has become so famous. So you can see it's been a long sort of drawn out history of wearing masks. And if I could have the next slide. For us at the American History Museum, we've been thinking about masks in multiple ways, and one is this political angle. And so I want to sort of leave you with this image, which I think in many ways reflects all of the controversies that we're seeing emerging around wearing masks, and this idea of our need to have all of us wearing masks to protect each other, and the backlash that we have often seen against mask wearing. So I want to throw this question out to my colleagues, because when I was invited to join this panel, I was really curious to hear about how you all were thinking about mask wearing, because I know I think about it mainly from a medical perspective and a historical perspective. And I know you all are approaching it from a very, very different angle. I like to joke that you have presented some beautiful masks, Anya, and I like to joke that we're actually looking for masks that aren't well made, because we're looking for masks that really illustrate people's attempts to make their own masks in a time of shortage and fear. And so people who don't sew well are starting to do this. So I'm curious to hear a little bit about how you all think about masks from a very different angle.
Well, I will say, as someone who works at the Renwick Gallery, we're sometimes known as the craft museum of the Smithsonian. And so for us, like, we are really seeing a lot of these wonderful artists who are shifting to making masks. So for example, Vicky, and going from weaving with cedar to then using cedar as well, but using a face mask. And we also have some works that are coming into the collection by people who do quilting. And so that's really great to see as well. But yes, I will say that with ours, I don't know if you could really, especially with the beaded one, wash it. So they are sort of specialized masks, but people could wear it if they wanted to. And I know that also with Cécile, there are some great masks also at American Indian that really kind of also reflect cultural areas. So you can really tell someone's tribal affiliation by what they're wearing.
Yes, at the National Museum of the American Indian, it's apparent that these masks are significant on so many levels, on a historic level of what's going on in the entire world, and how a global event is impacting the lives of people on, say, remote reservations. So there's the historic aspect of it, there is the cultural aspect of it. As Anya said, because many of the masks do incorporate traditional materials, traditional techniques, and traditional designs that speak to very specific cultural worldviews and how to think about disease and how to think about healing. Of course, we're also interested in the aesthetic aspect of these masks, which are very beautiful. And we're also interested in where the artists are coming from as personal individuals, because many Native artists are social activists, and a lot of the artists who are making these masks are, of course, very socially aware of what is going on in their communities. And so when they're making these masks, they are making statements about the fact that Native Americans in the United States in particular have been dealing with the onslaught of disease ever since Europeans came to the, quote, New World. And it's been one wave of disease after the other. And in some respects, this is just another wave from the outside that is impacting Native communities. And a lot of Native artists, when they're making these masks, they're very much aware of that.
I think it was really interesting and really provocative, Anya, when you were showing the mask that's used as a protest statement. And this is something that we've also been thinking about as well. For us, partly because we have a larger, broader initiative, we've been thinking a great deal about Black Lives Matter and how that crosses with the pandemic and masks, which reflect that activism. But I'm curious if you have sort of are looking at, as we're starting to think about as well, different ways in which the masks can reflect different issues that are confronting Native American communities today, a variety of issues.
Well, I would say especially with the example I showed of Katrina Mitten's mask, with bringing awareness to MMIW as someone who's wearing the mask. So I have also seen other artists who have maybe printed the red handprint on a fabric mask. So, I mean, this is really, we're seeing so much of these artists really responding to everything that's going on and being so creative with masks. And I know for me, I see a lot of these masks through social media. So Facebook and Instagram, I'm just really overwhelmed by all the amazing work that Indigenous artists are doing, in responding to the COVID-19 pandemic, while also, talking about solidarity with Black Lives Matter. So it's been really wonderful to see.
We've been curious to see, I haven't really seen this in any of the offers or social media that we've been looking at, people talking about, health disparities, which has become such a predominant aspect. It has become so clear, I think, to many, many Americans now, what the toll of this has been. And I'm curious if you all are seeing masks that are talking specifically about that issue as well.
Well, I think in general, they really all address this issue that for Native people, a lot of people have, as a population, have a high rate of pre-existing conditions. So that's one disparity. The second disparity, and I'll just speak in the United States, that the Indian Health Service that helps Native communities medically has been for decades severely underfunded and poorly equipped. And this, again, is something that Native people are very much aware of. They don't have enough hospital beds, they don't have enough nurses, and they don't have enough doctors. So that is very much on the forefront of people's minds.
And I would also add, also, of course, we've seen beyond masks. I've seen a lot of amazing posters coming out of Native nations that are using Indigenous languages to talk about COVID and about safety precautions. I've also seen a lot of public service announcements in Indigenous languages that are on tribal radios. So, and I even was able to see one that was in Mexico, where there was a website from this Institute of Health in Mexico that was listing all these posters in Indigenous languages in Mexico to be able to pin up everywhere. So it has been also great to see also the incorporation of Indigenous languages as well.
And are both of your institutions continuing to collect masks?
Yeah, for us, I think we have a slightly different approach than you all do. So some of the things that we're looking at is obviously we're interested in masks used by practitioners, but we're also interested in masks. You know, there have been a lot of groups of individuals coming together to sew masks for different communities and distribute them. So we're very interested in that sort of philanthropic homegrown effort. In fact, actually the first offer I believe that we had actually was associated with the tribal community coming together to make masks for members of their community and to share those out. For us, to some degree too, we're looking at a range of masks. You know, we actually would like a hefty amount of masks. And have thought about using them. We're doing an exhibit called In Sickness and in Health, which talks about the history of medicine. So sometimes we talk about and play with the idea of using those masks to create an art installation to really show what happened and the diversity and range of masks that people are creating. And as I said, I'm always looking for not well-made masks. We've had beautiful masks given and offered to us from seamstresses, but I'm looking for those handmade masks, which I think is very different from what you're all looking for.
Lexi, in your collections, are you collecting masks being made perhaps and worn by teachers? Because I know some teachers of young children, and they're very concerned that they don't wear masks that are off-putting or just scary looking for children.
Yeah, we've talked about, and we do have some actually that are specifically intended for people who do work with children. And we've also talked about the difficulties, obviously, that parents face in encouraging children to wear masks. So we're looking too at children's masks, you know, masks that use cartoon characters or just, you know, bright graphics that children like as well and are done on a smaller size as well.
And for the Renwick Gallery, we are also collecting from non-Indigenous artists, since it is part of the Smithsonian American Art Museum.
So are you collecting, I'm curious, are you both collecting masks that might be worn by children in Indigenous communities, or has the focus been more on adult masks?
At the NMAI, I don't believe we as yet have acquired any masks that are made for children. We're looking to collect masks from throughout the hemisphere. So right now, I would say we have about a dozen masks. We have Alaska Native masks, First Nation masks from Canada, of course from the US, and then we have masks made by Indigenous peoples in Mexico. So we're looking for a geographic spread at this point.
Yeah, and I will say that I haven't seen any child-size masks yet.
Yeah. Yeah, I think actually, to be honest, we've received about 300 offers from the general public. And of those 300 offers, I'd say about a quarter were mask offers. And of those, we've only received really, I think, 2 mask offers for children's masks. But for us, that's a really important element of the story to document.
And I also just wanted to quickly mention that one thing that's been wonderful is also seeing that a lot of Indigenous fashion designers have been shifting production to making masks as well. So I've noticed how like Trickster Company in the Pacific Northwest are now making masks, and then Econo Nav, which is Acoma and Navajo together, they're now making masks. Bethany Yellowtail, she also was wearing mask and partnered with Decolonizing Wealth Project to launch a limited edition mask. So I have also been able to watch that happen as well, of designers shifting production towards mask making.
Yeah, we've been really struck by that in our division as well, that shift toward mask making, especially by people who are seamstresses, and that's their profession. When Broadway went dark, a lot of people who were actually seamstresses for Broadway shows began making masks as well. So it's been really interesting to see this shift among traditional kinds of sewing professions. So for all about wanting masks that aren't well made, I've also been really struck by, and we are interested in some of these really beautiful masks.
And has American history made a point to try to collect masks from any well-known Americans?
We have thought about that, yes, and we've begun to do outreach to different individuals. Yes, we know and have sort of a list of some of these folks. And one of the groups actually that we are looking to collect from, Cécile, you mentioned the Indian Health Service. We've been working with the Public Health Service as well, and they received a major influx of, I think it was 1,000 masks from the Mennonite community, and those were obviously used by many public health service officers who work in the Indian Health Service as well. That was one of our first acquisitions because we began thinking about the pandemic early on. If you're a medical historian, we knew this was coming. So when this began in January, we actually reached out to different medical organizations then to begin a conversation. When did you all reach out or start to think about collecting masks?
For the Renwick, it was directly as I saw the exhibition posted. So it was about April, and it was wonderful to contact National Museum of the American Indian, and they were collecting as well. So that's when I really found that it was necessary for us to work together so that we wouldn't compete for the same mask, because of course, as part of the Smithsonian, there's always an opportunity that if there is a mask at American Indian that the Renwick would like to have on view, that, we're all one Smithsonian, so now the Renwick can have it on loan, so they can reach out to American Indian.
Hi, everyone. Thank you, Anya and Lexi and Cécile, for an incredibly stimulating conversation already. We've got lots of questions coming in. So we're going to transition now to the Q&A portion of our program. And I'm going to read out some of the questions that have been submitted by our audience, many of which sort of dovetail with topics that you've already been discussing. One of the questions, Anya, was how did you become aware of these sort of artwork type masks that you've been collecting? And I think you've just addressed that pretty thoroughly. There was another question that was really geared toward Anya and Cécile, and asking whether you can talk about the relationship between mask use and production currently, and traditions around wearing various types of face coverings for traditional ceremonies.
Well, Well, I do know that one mask that I saw that is, and I'm so sorry that I forgot the artist's name, but it's from the Pacific Northwest, and so it's a cedar carved cedar mask that would look like a mask that was normally worn, but it's covering the eye, so you can see above there, and then below it's actually a mask. So I thought that that was an amazing adaptation of something that's already there, you know, among many Indigenous Pacific Northwest communities, but then having it to adaptable to just more of wearing outside if it was. So fully carved cedar bottom half of the mask. And I'm not sure what else Cécile has seen.
Well, Native Americans traditionally have a very, very strong tradition of mask making, and these masks are used by and large in religious ceremonies, also social ceremonies. But usually when a dancer dons a mask, they're becoming another being. And the difference then between those masks and the ones that are being made from the pandemic is that the person who puts on the mask is not becoming another being. These masks, the person stays themselves.
That's a really helpful clarification. Thank you, Cécile. And Anya, your mention of the cedar mask that you saw raises another question that was asked by one of our viewers about the use of natural materials in some of the masks that you've recently purchased and even the one that you just referenced, and whether there's been any research, and this may be a question actually for you, Lexi, whether there's been research around the use of natural materials for masks, medical uses in masks.
Yeah, I understand. I mean, I want to caution everyone. I'm a medical historian, not a doctor and not a scientist. But I do understand that there have been discussions about the types of materials being used to make masks, and that some are seen as more effective than others. Obviously, the thickness, the weight, even if you're just talking about a cotton mask, that's going to impact the efficacy and the ability of that mask to protect you.
Thank you, Lexi. There were a number of questions also, I'm going to stay with you for a moment, around the 1918 influenza pandemic. And one of those was whether there is existing information about the impact of that pandemic on Indigenous communities. Wonder if you're aware of that, or if Cécile, you might be aware of that.
Yeah, it had a devastating impact on many different Native American communities. You know, I said scientists sometimes estimate that a third of the world became infected during that pandemic. And if you take that figure and apply it, of course, to the US, then you're talking about a large amount of the population. But also, if you're looking at factors that shape an individual's response to disease, and you're looking at things like poverty, how that impacts the body's response, then obviously looking at Native American communities, you're going to see a much more devastating impact of the disease then. The problem is that our figures aren't always accurate from that period, so it's difficult to tell, but we do know that it impacted Native American communities much more than other communities. Sorry, Cécile?
Yeah, the early 20th century was a very bad time for Native Americans health-wise, because they were suffering from many different diseases, and then the influenza pandemic took its toll too. But that came after many other waves of disease were sweeping through reservations.
Thank you, Lexi and Cécile. Actually, another very closely related question that just came in about whether or not, oops, I've just lost it. Where was that question? About what the response of Indigenous communities was during and through the 1918 influenza pandemic.
Well,
go ahead, Cécile.
Well, at that time, Native American communities didn't have a lot of autonomy. Their lives were really much being dictated by the United States government, who was appointing people that they referred to as Indian agents to administer reservations. These were non-Native people that by and large did not have respect for traditional Native forms of self-governance or religious practices. So Native people were very vulnerable at that time, which is what I'm trying to say, and not, it would be decades before they would become much more stronger again in their sovereignty and self-determination.
And I would just add exactly what Cécile said, and also just to understand too that understanding of disease was fairly rudimentary in comparison to today. So that also impacted and shaped this.
Thank you, Lexi and Cécile. Actually, sort of related to your comment just then, Lexi, about sort of the sort of rudimentary, or still rudimentary understanding of disease and germ theory during the time of the 1918 pandemic. There was a question about the makeup of masks during that pandemic in terms of the materials and how it compares to the materials that are being used today.
A lot of the masks would have been made from cotton and gauze, just as to some degree they are today. But there was a poor understanding of, there was a recognition that viruses existed, but they did not know that influenza was a viral infection. And viruses are really, really tiny. So sometimes using a gauze mask, which had a very loose weave, might not be very effective. Yeah, so they use similar fabrics today, but we have a much tighter understanding of bacteria and viruses. Germ theory was still a relatively new idea in the early 20th century. Most Americans had come to accept it, but still pretty new idea.
That's great, thank you. And thinking about sort of today and the collecting that's happening at American History, the types of masks and other medical objects related to the current pandemic that you're looking to collect, is there a focus on innovative design that's also happening at American History? I suspect that our sister institution, Cooper Hewitt, may also be thinking about the design that's being employed in sort of medical instruments and other materials.
Yes, absolutely. And the design even of things like the vaccine vials as well, because there's a need to mass produce them on a rapid scale. So we've been looking at that as well, very much. And also it's interesting because, you know, it's fascinating to me that the vaccine, 2 different ones came out very quickly. You know, many people are working on the same problem, coming up with just slight variations on solutions, and design is really a fascinating difference in many ways between what they're doing with some of these. But I think the design of the masks, I mean, I have to say, I've been really I was struck by the power of the masks that you were showing, Anya. The design is just so beautiful there.
Speaking of that, Lexi, Anya, this is a question for you. One of our viewers was curious about the symbolism of the red hand on Katrina Mitten's mask and what exactly that refers to.
Yes, so, and I think I also answered it. It is the silencing that has gone on of Indigenous women and also Two-Spirits who have been, there's all these cases of murdered and missing, you know, Indigenous women and Two-Spirits and girls. And so really the lack of, in Canada and the United States, of really a task force to do it. So a lot of communities, they have Indigenous now groups who are now being really proactive to make sure that they're that there is some justice that's happening. So it's more of a symbolizing of the silencing that has gone on about these horrible cases throughout North America.
Thank you, Anya. Speaking of symbolism, there was a question also about whether there is a kind of prevailing symbol that's begun to trend for the coronavirus itself, and whether that's being used in any beadwork or carvings that you've seen. And this is a question that, Cécile, you could also address for us.
Yeah, I'm not aware of that. Anya, are you?
Yes, and I'm trying to find it. This amazing First Nations artist, her name is Ruth Cuthand, and she has been beading images of diseases. So she is someone who has taken images of the microscopic, viruses, and then she'll bead it. So she did have one for COVID-19. So I do know that Ruth Cuthand has done that.
Great. Thank you, Anya. Okay, we've just got about 7 more minutes in our program, and I have a few more questions, both from our audience as well as one that I've been dying to ask you all. But we'll first start with this audience question. One of them was about whether there are any upcoming virtual workshops at any of our institutions for youth and families focused on mask production and design.
Don't know of any.
It's a great idea, though.
Yeah,
we'll take that and run with it.
Absolutely.
So I'm curious also what it's been like for each of you and your respective institutions to be collecting during a pandemic. What have the unique challenges been, especially during a period of lockdown for our various museums and for many other organizations? So how has the collecting unfolded, and what have you had to sort of adapt to in order to make that possible?
Well, there's certainly a sense of urgency and a sense that this is something that we should be collecting material culture that relates to the pandemic. The challenges are that a lot of staff are teleworking and not actually going into the museum. And so therefore to acquire the object, staff isn't traveling to go out and meet artists or to go to art shows or to go to galleries. So that's not happening. And then the other thing is to receive the object. When it gets mailed to the museum, there has to be somebody there to receive it and process it. So special arrangements have to be made so that can happen.
And I would just say, same for me. I'm actually teleworking from San Francisco. So I flew back home to be with my family during the pandemic. And I know that social media has been really helpful for me to be able to see what's happening really across North America. And also for me, I live in a traditionally Latinx neighborhood. So I've been seeing a lot of indigenous Mexican face masks that are being produced and sold in the local shops. So I think we all are really trying our best as we are in our different locations to really acquire as much as possible without being able to physically be in the buildings.
I think what's also really difficult for us is we look also to see the story of the individual behind the mask and the history. And we want to document these really important stories. And we're looking at a nation and people in crisis. And so going to communities that are in crisis, whether we're talking about the Navajo or we're talking even more broadly about just physicians, to say, hey, we'd like to collect. That's very difficult, if not really impossible to do. It can really, I think, be detrimental to those communities. And so we've had to be very careful in how we approach different groups as we think about collecting.
Thanks, Lexi. I mean, your point about the challenges of real-time collecting, especially during a global health crisis like this, brings up another question that was asked of one of our viewers, and this was more directed for Cécile and Anya, whether either of your or our institutions have ever engaged in the kind of real-time collecting around a social or a public health issue the way that we are currently.
So I would just say quickly that our museum did this around 9/11 and also around the HIV/AIDS pandemic. So we do have somewhat of a small roadmap for this.
I'd say this is more or less unique for the National Museum of the American Indian too. We did not collect around 9/11, but we did collect a bit around the Iraqi wars and with Native American veterans who were involved in those conflicts.
And I would say for the Renwick is 48 years old, so it's actually kind of a young museum. And I do know that the collection, is very expansive with the idea of craft. And so we do have a lot of works from artists who are, as like Cécile mentioned, who are veterans and responding to really a lot of their experiences that they've had.
Thank you all so much. I have one last question from one of our viewers, and then we'll wrap up. And that question was related to where might someone from the public purchase a mask by a Native artist to help support those communities?
Well, one thing they could do is, I believe it's the April issue of First American Indian Art Magazine, and they represent about 75 Native artists are featured there, and you could just look up those artists' websites and see if you can get in touch with them and purchase from them.
And also the ones that I mentioned, Trickster Company, Econonav, so ACONAV, Bethany Yellowtail, and I believe like Kevin Purrier, POURIER, he shifted towards mass production as well. So there's a lot of Native artists who had e-commerce sites that were able to also shift into selling mass.
Great. Thank you all so much. I just want to give you an opportunity if there's anything, any final comments you'd like to share with the audience before our program concludes.
It's been a pleasure. So especially for someone who is in San Francisco right now, to be able to see my colleagues this way. So
It's been a real pleasure to see and think about masks from multiple different perspectives. So I want to thank you all. I think it's been a fascinating discussion, and I hope it will continue.
And it's really been a pleasure to be able to call attention to the work that Native American artists are doing in response to COVID-19.
Thank you. On that note, I'm so appreciative to each of you, Anya, Cécile, and Lexi, for your time today, and for our audience's attention to this really important topic. One of the sort of wonderful features of working for the Smithsonian, at the Smithsonian, is the interdisciplinary potential to have conversations like this. So thank you for a really stimulating one this afternoon. And that concludes our program.
Thank you. Bye-bye.
thank you, everyone. Thank you.